welcome everybody to this information session on a very unique program here at the School of Continuing Studies, University of Toronto School of Continuing Studies. I just wanted to mention that this webinar, including all voice videos, feeds, the slides, any chat communication, will be recorded and made available to all participants next week. If you have any questions at all throughout the session, please go ahead and use the chat panel. You do not have the ability to share your video, your audio at this time. So the chat panel is where you can communicate with us. We will have a designated question and answer period close to the end of the session. And I'll make sure that I'll moderate those questions and ensure all that are answered during the session. If we need to, we can follow up post-session to you directly. So with that, I just wanted to start with a land acknowledgement. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Senecas, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work on this land. So with this is my distinct honor to introduce you to Dr. Shelley McMain, who is on screen now. Dr. McMain is the head of the Borderline Personality Disorder Clinic and a clinician scientist at the Center for Addiction and Mental Health, also known as CAMH. She is an associate professor and head of psychotherapy, humanities, psychosocial division in the Department of Psychiatry at the University of Toronto. She is the co-founder of the Center for Mind-Body Health in Toronto. She's trained in dialectical behavioral therapy in Seattle in the mid-90s with Dr. Marsha Linehan, and obtained her DBT individual and group therapist certification as well. She's the president of the newly formed World Dialectical Behavioral Therapy Association, and she's also the current past president of the Society for Psychotherapy Research. Dr. McMain conducts research in dialectical behavioral therapy, personality disorders, emotional regulation, suicide and self-harm, substance abuse, and psychotherapy processes and outcomes. She's delivered over 300 conferences, grand rounds, trainings, and has received several awards for excellence in research and teaching. We are absolutely honored to have her here and to share a little bit about our certificate program in dialectical behavioral therapy. So with that, I'm going to stop sharing my screen to allow Dr. McMain to share hers, and I'm going to hand it over to her. And Shelley, you're muted.
Okay, I thought I'd turn that off. Okay, thank you, Jen, for your very warm welcome. I will just share my slides and give me a minute to do so. Perhaps let me know if you can see the slides. Yeah, okay, yep. Perfect. Yep. Okay, I will skip past this because we've already heard this. First of all, welcome everybody and thanks for joining today. This is an opportunity to hear a little bit about what this DBT certificate program entails and to address any questions that you may have. So I'm hoping people feel free to ask whatever you need to ask about the course to better understand what you might gain from this. I'm assuming that most of you have some idea about what dialectical behavior therapy is. If you're already curious enough to be attending this webinar, you probably heard of DBT, you probably know something about it. You probably are aware that it is a form of cognitive behavior therapy. So very much like cognitive behavior therapy, there is a present focus in this therapy. And I would say in DBT, like CBT, there's a little bit less of a focus on the history, talking about the history of what led to problems, and much more of a focus on what's happening in the here and now, and how to help people make changes in their daily lives. It is in contrast to CBT, DBT emerged as a treatment in the early 90s, largely to address a much more complex client population that I think CBT was originally designed for. It's largely been developed for clients who have significant problems with regulating their emotions and their behaviors. Marsha Linehan, who's the treatment developer, originally developed the treatment in the context of working with chronically suicidal patients, and the treatment later became largely a treatment that was geared to individuals who met criteria for borderline personality disorder. But in the past 20 years, DBT's expanded to many patient populations, client populations, and I think the common denominator across these client populations is that it's a therapy that seems to work very well with clients who have problems with impulsivity, difficulties with modulating their emotions. They may find their emotions are intense or unpredictable, or they may find it hard for them to control the behaviors that go along with intense emotions. So that's typically who the treatment's geared for. In contrast to perhaps very unstructured approaches where clients enter a therapy room and talk about whatever's on their mind in the moment, DBT is a bit more structured and in that sense like CBT. So there is a focus on helping people get clarity on what their goals are for treatment and helping them always stay focused on moving towards those goals. Like CBT, the treatment developed with a very strong foundational value on empiricism. So the focus has very much been, since the development of the treatment, has been very much on what works. Does this work? And a lot of emphasis on researching what works. And if it doesn't work, then there have been modifications to the treatment, and there have been modifications to the therapy over time, largely due to the research. So that's just DBT in a nutshell. So I think if you're someone who's looking to strengthen your own clinical skills in working with more complex client populations, then this approach might be relevant to your work. Just by way of, background in terms of, when you're learning a new therapy, obviously there's many things that you can learn, and this is true for DBT. There's strategies and there's theory to understand. There may be special elements of the treatment. So one of the things that's been happening over the past 2 years in the international field in DBT is there's been a group of us working to develop a World DBT Association. And in fact, the association has just been incorporated, so this is all very new. But part of the goal of establishing this World DBT Association is that we wanted to work together to establish international standards for training. And so I wanted to actually share with you what are the recommendations that have emerged from our working group that has been focused on identifying the domains of training, because the reality is there's many training programs that one could take when learning a therapy. You can take various trainings in DBT. And I think what you want to be thinking of is, does the training program cover the recommended domains of training? These aren't yet out in the public, but they will be. We're just in the process of getting the World DBT Association website set up. But the idea is these recommendations will be disseminated. But some of the foundations that are really considered essential in DBT, and you'll see these themes across the certificate program that I've designed. But the foundations are that people have some background in the theory underlying the treatment. So in other words, you understand how the treatment's been developed, You understand, for example, that it's based in behavioral science. And it's also based in a focus on mindfulness and acceptance principles. And in this sense, it's considered one of the third waves of cognitive behavior therapy, with a much greater emphasis on acceptance versus a focus on change strategies. There's also a focus on dialectics and dialectical philosophy, because that is a core theory that underlies the treatment. Sometimes, we wonder, well, how does theory translate into practice? And I would say it's highly relevant to practice, because when you're working with more complex people, there's always the challenge that you've got to make a decision about how you're going to intervene in a particular moment. And there's never one approach that you can take in that moment. There's always a variety of strategies that you could use and you could utilize effectively in any moment. But I would say that the theory and understanding how you're trying to help people change is going to be critical to making a determination of what strategy may be most useful in a particular moment. If my theory is that, for example, that everything my client does makes perfect sense, in some capacity, it makes perfect sense, then it does mean in every moment of an interaction with my client, even in moments when I might feel frustrated with something my patient is doing, client's doing, I'm going to be always attending to and looking for the element of what does make sense. And I'm going to be always highlighting that in my interaction. So there is a focus on theory that's going to be critical, and you'll see this through the course. There's a focus on how to structure therapy. And when we talk about structure, we're talking about, for example, there's different modes of DBT. There's individual therapy, there's skills training, there's a consultation team. In addition to the different modes, how you intervene in any moment is really going to depend on, first of all, what's your role? Are you, an adjunctive therapist, or are you the primary therapist? It's also going to depend on how severe the client's problems are and what particular clinical problems should take priority in a particular moment. So that's what we mean by structuring the treatment, is getting clarity on who's doing what do you focus on when, and how do you decide when you've got multiple different directions you could go, how do you decide what should be prioritized? Another domain, and this will be a focus throughout all the courses, are the core strategies of DBT. And in DBT, there really are three core strategies. On the one hand, there's a focus on problem solving, problem assessment, and change strategies. There's also a focus on validation and acceptance strategies. And there's a focus on dialectics and being dialectically balanced, and how to use dialectics, which means really being able to integrate and blend a focus on both pushing your client at times to make changes within the context of a lot of acceptance and a lot of compassion and a lot of acknowledgement of where they are in a particular moment. As well, other key domains that have been recognized as really critical aspects of learning DBT involve knowing how to assess, how to manage suicide risk, how to deal with crisis behavior. And again, from a particular framework where a lot of the focus is about how do you actually treat suicidal behavior, crisis behavior, and understand this behavior in the context of other challenges. And then finally, the last area that has been deemed really an important domain of learning is how to work with ancillary treatments. A lot of us are working with clients who have multiple healthcare providers. And sometimes the challenges are knowing who's doing what, knowing who should take responsibility for what, knowing even what makes sense. You know, doesn't make sense, for example, that my client is seeing somebody for addictions therapy and seeing me for a trauma-focused therapy. Is that a reasonable treatment approach? So navigating multiple treatment providers, also being clear on who manages crises and how to manage crises is all part of some of the special treatment strategies. So these are the core and really considered fundamental domains of training that have been deemed critical by the World DBT Association. And you'll see that these are really the themes that cut across the various courses in this certificate program. So I'll just, on this side, I want to highlight what the certificate program offers. So you can also get a sense of which of these courses are relevant to your own training, whether the whole program is relevant to your training or not. So the program is organized such that there are 2 foundation courses. And the foundation courses are both 4 classes each. It's the basics and the beyond the basics. And those really are critical, essential, both theory strategies that are necessary to be able to engage in the other courses. In other words, you can't do the individual therapy in DBT unless you know the basics of basic strategies. However, I recognize that there are many people who are not looking to become a DBT therapist. They're not looking to really develop necessarily excellence in DBT. They may be looking to become familiar with DBT, and they might want to integrate some strategies into their existing practice, but not be looking to do more than that. So for some people, doing the foundational courses might feel sufficient, but for other people, for example, who want to go on to do individual DBT therapy, or want to know, for example, how to run a DBT skills group, and also want to engage in full DBT with a consultation team, the elective courses would be important next steps after the foundational courses. So you'll see here that the elective courses have been designed so that people can take all of them. If your intention is to perhaps become a certified DBT therapist, it would be essential to have training in all of these modes. But again, some people might not be looking to really develop expertise in DBT. You might be interested in running a DBT skills group in addition to other things that you're doing. And it may be that you're simply looking to receive training in the foundational courses and learn how to run a DBT skills group, but you may not ever be necessarily planning to deliver DBT individual therapy. The entire certificate program is a total of about 46 hours, 40 hours in class time, and then there's a total of about 46 hours of out of class time. And by the out of class time, what I'm referring to here is there is the expectation that people would be engaged in reading. And so there are assigned reading assignments as well. There are other tasks that are assigned. It's pretty hard to learn how to learn a therapy if you're not also practicing at the same time. So for example, some of the assignments, for example, in the individual therapy course might be developing a case formulation. Some of the assignments in the foundational course might be practicing some of the DBT skills, because we introduce some of the DBT skills in the foundational courses. There's also a discussion board, and each week you can ask questions on the discussion board and your questions will be responded to. So the intention is for people to be able to interact with the material, practice it, engage with it, and be able to have an opportunity to ask and then deepen your learning as you go. I'm going to highlight here so you have a better sense of what's involved in the foundational courses. So again, the basics is the first course, and this is where you'd be introduced to the model of the treatment, the principles of the therapy, the core strategies, as I've mentioned. And again, it would be a range of different ways that we'd learn through a combination of lectures and role plays and discussion and demonstration of some of these strategies. And then in the Beyond the Basics course, it would go a little bit beyond what we've done in the intro course. And some of the topics to be covered here would include case formulation, sort of an intro to case formulation, how to target very specific problems using behavioral chain analyses. How do you address problems that arise in session? You know, for example, clients coming to late to sessions, or clients being intoxicated, or maybe clients being angry with you in session. How do you strengthen your validation skills? In other words, how do you stay compassionate and empathic in responding to your clients throughout? And how can you utilize dialectical strategies to try and decrease tension in your interactions maybe with your clients and maybe with your colleagues at times that tension can arise. So these are the elements of the 2 foundational courses. And then moving to the elective courses, you'll see, first of all, there's a course organized for people who are interested in engaging in DBT individual therapy. And this is much more hands-on. So you'd get more advanced training in analyzing problems, engaging in case formulation, designing a treatment. You'd be working through your own cases. So ideally, people would be presenting clinical questions from their own work, and that we'd be able to apply what we're learning to those clinical examples. The skills course, a bit different, because this is geared to, it's a 7-day course, and the course is geared to both learning the skills, but also learning how to teach the skills and learning how to help people acquire skills. Now, you'll notice that, again, the skills training really requires knowledge of the other strategies, because in DBT, it's not simply about sitting people down and providing didactic information on skills. You need to be able to engage people in the moment. And when you're teaching a skill and perhaps your client is angry and dysregulated and tells you these skills are stupid, you need to know how to respond in those moments and respond effectively. So it's how to deal with those challenges that arise, emotional dysregulation in the group, therapy interfering behavior as it arises, and always being able to respond to it in a way that you're really paying attention to try to help clients really strengthen their own skillful behavior. So, and then finally, this last course is the 4th mode of DBT. So it's the consultation team. And the way this course has been designed, it's really structured, part of the course is structured as a typical DBT consultation team. So here, the expectation is that people would learn to present their own clients, own cases, clearly, concisely, be able to provide consultation to one another, be able to learn how to address problems that arise, both in your work with your clients and also problems that arise with your colleagues, and the feedback that you're getting from one another. So it'd be really learning how to apply the DBT strategies with other cases as they come up. So those are the 5 courses that are part of the certificate program. Maybe at this point, what I want to do, and I know definitely going to leave lots of time for questions, but I do want to say, I think, a few words about certificate programs versus certification, because there's often many questions that arise around what the difference is. So I do want to highlight, what is this DBT certificate course and how is that different from DBT certification? And it really is parallels what's the difference between a certificate course and certification. So the purpose of really certificate courses is to try and build your capacity in a particular skill set, in this area, DBT. So in this particular course, obviously provides instruction and training on DBT. The goal is to help you acquire skills, acquire competencies. The goal is to help you be engaged with the material, and to be able to observe, and me to be able to demonstrate and you to be able to observe specific skills in action. And, generally certificate courses are live because it allows for a bit of an opportunity to demonstrate, to participate, to ask questions. There is an opportunity to have a little bit more back and forth, which I think is a really helpful way to expand your skill set, different from an online course where you often don't have back and forth discussions in the moment. How is that different than a certification in DBT? So certification basically is a process that recognizes a professionals who've established a certain knowledge or competency in an area. So certification in DBT is a process of being assessed to ensure that you have the competencies in a particular area. So in other words, you're evaluated on what you're doing. You're evaluated on what you're putting into practice. DBT certification, to achieve DBT certification, first of all, can be done through the Linehan DBT Certification Foundation. To go through the process of being tested, first of all, you need to demonstrate that you've completed at least 40 didactic training hours specific to DBT. So this course would allow you, this would be part of the requirements, and it will allow you to say, yes, I've done, if you do the whole certificate program, I've completed the 40 hours of didactic training by a credible training program. And in addition, to achieve certification, you need to be able to submit therapy tapes, and somebody would actually watch your psychotherapy tapes and evaluate how you're delivering the treatment. You'd also complete an exam, and you'd also write up a case formulation and be evaluated on your case formulation. So the key difference between a certification is that it's a process of examination. And once you've passed the exam, you're now recognized as a certified DBT practitioner. And that would allow you to say that you're certified. Whereas certificate program allows you to say that I have completed a certificate course. So I'm going to pause there, because I think there may be questions that people have.
Thank you, Shelley, for that information. I'm going to see if I can actually show myself to everybody.
Sure.
I'm just monitoring the chat to see if any questions do come through.
Feel free to shout out or put your questions in the chat.
Yes, everybody, if you do have any questions, feel free to post them in the chat there. So we do have a question about what is the cost and start date for the courses? Shelley, I'm happy to take this one, or
Yeah,
if you,
thank you.
yeah,
Because you
no
probably have
problem.
it all in front of you.
Yeah, absolutely. So we do offer the full program. All the dates are already published on our website, so I'll post a link in there. We're offering our foundations first 2 courses in this fall term, and we're repeating foundations in the winter term, and then we will progressively offer the electives throughout the rest of the academic year and into next academic year. All the dates are currently up there and posted. The courses do range slightly in cost. The foundations level, a part 1 course is $649. Part 2 is also $649. The individual therapy is $999. DBT skills training is $799. And for some reason, my screen is just not showing up on the DBT consultation team, and I don't want to make up an amount here, so we'll follow up with those resources for you post session. It looks like there's another question there. Is there an in-person way of attending?
I can answer that. At the moment, these courses are currently entirely virtual. I don't know, Jen, if there's any plans in the future to go back to in person. They were prior to the pandemic, all in person.
So at this time, we did migrate the full program online, and that's the current delivery modality. We're always in discussions. This program is offered in partnership with Dr. McMain, and so we'll continue that conversation. You have noticed probably if you've been on our website that we are starting to increase our in-person offerings as we emerge from this from the pandemic. So stay tuned. Feel free to reach out for more information at a later time, and I'll be happy to share it with you. Okay, looks like there's another question in here. I've completed some training with Jill Arathis. Will I have to complete the basic courses?
So great question. And I think that what I would recommend, many people have done a variety of courses. I would say that probably best thing is to reach out to us if you're uncertain about whether this course is for you, because if you already have a background, and I know Jill, and I know she does fabulous courses, so you may perhaps have already completed what would be the equivalent of a foundational course and be ready to move on to something else. So reach out to us if you have specific questions about whether a course you're in makes most sense or a course you want to sign up for. The last thing we'd want is for somebody to end up in a course when they felt like they don't have the background for it and it wasn't appropriate.
Absolutely, and I'll post my contact information. So I'm the program director that oversees this program, so you can feel free to ask me any questions you have, and I'll consult with Dr. McMain as well on those. There is another question in there. It's actually on a similar front. What prerequisite is needed for the program? Just a bit of context about this individual who is a mindfulness and yoga instructor and is interested in learning more about DBT, but is not a clinician at this time.
Yeah, it's a great question. Lots of say non-practitioners, non-clinicians take courses in psychotherapy. So it wouldn't preclude you from taking a course in psychotherapy. We certainly have. I've had family members take courses and benefit from taking the courses. So there isn't an exclusion to people who do not have a psychotherapy training background. And of course, if your goal is to practice and implement the treatment, it would be beneficial to have some basic psychotherapy training.
That's great, thank you. If there's any other questions, feel free to put them in the chat. We'll give it a few more minutes, and if there's no questions, we will stop the recording, but just stick around for a little bit. So if anybody wants to ask any additional items, they most definitely can. And just for a little context here, just about our certificate program, is that it is open enrollment, so you're able to register, enroll in courses as you wish. You do not have to enroll into the certificate program itself. Okay, that's a great question. So there's another one. How many students are usually in a course? I could.
Yeah, maybe you could
okay.
share.
Yeah,
variable.
Absolutely. So it's pretty variable throughout. The foundation courses tend to have a higher enrollment than the electives. So we really range, and due to the pandemic, we've ranged quite significantly. You could see about 40 to 60 individuals in some of the foundation levels, whereas more 30 to 40 individuals in some of those elective courses. But again, it's hard to predict how many learners will be registering at any given time. So it does vary year to year.
Any other burning questions from people? Or maybe not burning questions. Here's your chance.
Okay, so we'll just give it a few more minutes. So I'm just going to alert everybody to the chat if you haven't seen that already. I put my direct email in there. So if you have any questions, it'll come straight through to me, and it just makes it a little bit more efficient to get a response at this time. We do have a great enrollment learner services team that's available to answer any questions, and they are available by phone and I'll put that information in the chat as well. But if you need anything, feel free to just reach out to me directly, and I'll do my best to get you all the answers that you require. So there's a question about payment plans. So I'm just going to jump in and take this one. Unfortunately, there are no payment plans here at the School of Continuing Studies. So we do require full payment at the time of registration. I will put a link to some of our financial assistance opportunities that we have here at the school you can view and see if something there aligns to you. And again, full payment at the time of registration for the course that you are enrolling into. Again, you do not have to register for the full certificate program. So sometimes learners will be taking the program over a couple academic years. These are excellent questions. Keep them coming if anybody else has any other questions.
Curious whether sometimes there's questions about relevance. Is this relevant to my practice or my role, what I do? I'm not sure if anybody is wondering about the relevance of what will be covered.
Okay, so it looks like there's no questions. Again, I'm going to stop the recording just after I thank everybody. Thank you for attending. Thank you, Dr. McMain, for coming and sharing just a bit about this program and the context and just the value of what this program can offer. Again, this webinar will be distributed, a recording will be distributed to you next week with any additional resources that we send along as well. If you have any questions, feel free to follow up with me directly, and we'll do our best to try to get you the answers as soon as possible. So again, thank you, everybody. And with that, I will stop the recording.